Hi, welcome back to Body Beautiful. I'm Janelle Marie. With us today, we have plastic surgeon Dr. Joseph Mele. We are talking about a couple different procedures today, lots going on. All right, so now we are going to talk about breast implant revision, okay?
Okay.
So first off, why do implants need to be revised? What's the problem?
One of the most common reasons is just to put larger implants in. And
Oh,
I think
that's
that's completely volitional. Sometimes our minds change. Sometimes we're a little scared the first time around, thinking we don't want to be too big.
Yes.
And I think also there's some swelling involved with the surgery. So during that recovery period, there's a little extra volume, and sometimes people kind of fall in love with that and they want that
really?
But that's probably the most common reason. But there's other reasons that aren't volitional.
Yeah, like what?
So if the implants deflate, really, with the saline implants, when they deflate, they go flat.
Oh,
so
that's not good.
There's no fix-a-flat.
Yeah.
You have to go in there and replace the implant.
Yeah.
And also for implants, there's a capsule that forms around the implant that keeps it in place, which is really important. Without that, the implant would just drop and move down to the belly eventually. With that capsule, it needs to be firm enough, but not too firm. And if it gets tight or thick, it may make may change the shape of the breast. May make the breast feel firm or move the implant over, and that's called capsular contracture.
Oh.
And in those cases, we want to get in there and either remove that scar or modify it in some way to soften the breast and get things back even.
So when you do that, you revise, do you have to follow the scars you did last time, or do you make new, so let's say it's been a while and there's a new, way to go in, do you have to follow? Oh, really?
It depends. Often we will, because the scar's already there. And we don't want to make a new one.
Which is better, right? Is that,
well, you don't want to make a new scar unless you have a reason for it. I will say sometimes women will have saline implants placed the first time around. Right. And later decide they want to switch to silicone gel. Right. The saline implants go in empty, so they can use a much smaller incision when they put those in.
Oh, okay.
And often it'll be around the areola.
Okay.
With the gel implants, they're pre-filled. So we need a little bigger incision, otherwise it's a higher chance that the implant's going to leak because you stress it out putting it through too small a hole.
Yeah, exactly.
So often we'll have to go through the inframemory fold. So sometimes we will change position just because of the implant. Yeah. Or there may be some other advantage of using a different incision. Okay,
wonderful. We've got some pictures. Let's go to the first picture here. All right, what happened?
So here's someone that has capsular contracture.
Oh, look at that.
So the breasts, it's hard to tell with the color here, but the breasts are actually a little bit more red. They look kind of angry. Yes. The base diameter has been shrunk, so that the implants look a little bit small for the chest.
Yeah, they do.
As a normal breast, you'd expect it to feel a little wider. And they're firm. You can see kind of a sharp definition where the implant is and isn't. And what's happened is the shell...
And those are the ones on the left.
On the left,
yeah, okay.
What's happened is the shell of the implant's been squeezed by the scar. So that scar is now the new shell of the implant. Basically, you have that same amount of stuffing in a tighter space, so it feels firm.
And it's kind of lumpy there, too. It's got kind of some ripples on it and things? Or?
Yeah, it can buckle. The implant can buckle. So what I've done is gone in, removed the previous implant, removed the scar, so let things start again, and then exchanged it for an implant. I'm not sure I even put a bigger implant, but it always looks bigger
just
when we stretch
fuller.
that out.
Okay.
So here's a deflation. So this is the phone call I usually get is, yesterday it was a little soft, today it's gone, I haven't had breakfast, can we fix it now?
Oh, and you have to fix it now.
Because it's urgent. Yeah,
that's pretty urgent.
We want that repaired.
Yeah.
So on the left side, left picture, or the right breast from the viewer's perspective, there's a deflation, and essentially what I've gone in is just replaced it. Most implants do come with a warranty.
Oh, they do?
So the implant itself is replaced lifetime if
that's
it's one of the FDA-approved companies.
So you don't have to buy a new implant.
Don't have to buy a new implant, and most of them, if it happens within the first 10 years, they give you money towards the surgery to have it replaced. So they do stand behind their product that way.
That's good.
Because we know 1% a year are probably going to have a problem with leakage.
What happened here?
So here, again, a little bit of tightness on the right, on the patient's right, on the left side of the screen, where the implant's been pushed up by the capsule.
Oh, yeah.
So in this case, I didn't remove all the capsule. It was very thin. It's transparent. But what I did was release the lower part of the capsule. It's called a capsulotomy, and that makes more room and allows the implant to drop so that they're even. Because this is a problem even in clothes.
When you see pictures of celebrities or whatnot, and the breasts are very high, almost to the neck, is something going on, or is they just got too, way too big? It could be either.
If they're new implants, that's normal.
Oh, okay.
If it's been 3 months, usually it's settled down. Certainly by a year,
everyone's
settled down.
I gotcha.
If it's a long time out, then maybe they've got a little capsular contracture.
All right. Next pick.
But it's all fixable. So here's someone, my opinion was she was a little oversized. Their implants were a little bit bigger than her body and skin could hold, and they're bottoming out. So the nipples are way up on the top, there's extra fullness at the bottom. She'd had a previous lift to try and correct this. So you can see that scar, that was a mature scar. Okay. What I've done is we talked a little bit, thought she was a little bit big too. Yeah. So I put a little smaller implant.
They look beautiful.
Redid the lift. There's still a scar there, but it's much paler this time.
All right. Very good information. If you want more information about Dr. Mele, you can call him at 925-943-6353. Check him out on the web, drmele.com, sanfranciscobreast.com. We got to go. We'll be right back. Stay right here on Body Beautiful. Lots more.